Hi everyone. My name is Daniel Avasar. This is the Building Brain Awareness Talk series. Today we're going to talk about neuroplasticity and brain injury. So we have two talks set up. They're not short talks. It's going to be about 45 minutes each. So I think Jerry is going to present first, and then I will present. There's not going to be a lot of time for questions during the presentations, but afterwards I'll stick around. And you can also put questions in the chat and email me or email Jerrod later. We're kind of trying to shove too much information into a jar that is just not enough time. So also there's a lot of information here that it'll go out on YouTube. Jerrod, why don't you take it away?
Dan, thanks for having me back.
Thanks.
Hope all of you are doing well. I recognize some of your names. I know you've been here before. So I'm going to give a broad spectrum overview of the topic of neuroplasticity today. And as Dan said, yeah, we have too much information to cover. Neuroplasticity is a huge topic, but I'm going to plant the seeds with all of you, and hopefully you recognize the importance that you need to take your education to the next level because neuroplasticity can be applied to really almost any setting, condition, disorder, whatever it is. So here's what I'm going to cover today. I have three different sections, give you a broad spectrum overview of neuroplasticity, talk about what you might want to consider during an intake, screening, interviewing process, and then wrap it up with a number of different tips, strategies, solutions, and interventions. So to give you this overview, I'm assuming most of you are familiar with at least the basics of neuroplasticity, and it's been studied within the context of brain injuries. Obviously, that's a big focus of what we're covering today, but you can apply neuroplasticity to depression, anxiety, the treatment of trauma, neurocognitive impairments besides brain injuries. The list goes on and on and on. But I love this research because it gives me a lot of hope, regardless of where someone's at brain-based wise. Neuroplasticity can provide avenues for other interventions, avenues for healing, avenues for growth. Again, it's going to depend on a number of different factors. Everybody is wired differently. Every head injury is different. What happened to the person before, during, and after the head injury has a lot to do with this. But maybe you're here too, and it's not just head injuries you're interested in. Take out the word head injury and place in any kind of impairment situation. If you're a leader in your organization, if you're a manager, if you're a coach, a counselor, therapist, learning the basic principles of neuroplasticity can be very, very helpful. This is a full day training in and of itself, this one particular slide here. So synaptic plasticity would be a term you want to be aware of. Structural plasticity and functional plasticity. These are big, big subtopics of plasticity that come up in this research literature. There's a lot packed into here, but synaptic plasticity, again, think of it as maybe someone is on the phone with somebody else. It's that connection between the two phones. Think of that and apply it to the brain, the connections between our neurons. If we can strengthen this, it shows that it plays a critical role in learning and memory. Structural plasticity, brain's ability to physically change its structure and forming new neurons. Here's another term I want you to be aware of: neurogenesis. These are all very important search terms just to be aware of, and I would jot these down. If you want a copy of my slides too, just shoot me an email. And then when you hear this term functional plasticity, kind of think of as it applies to everyday life. Some of the functional plasticity literature relates to strokes and regaining kind of functional capacity. But functional plasticity, a lot has to do with kind of regaining some of those skills related to day-to-day functioning, adaptive functioning, functional impairments, functional limitations. Those are things you want to be aware of as well. What are things that can adversely impact neuroplasticity? Well, again, a head trauma, without a doubt. If someone is dealing with a high level of depression that goes untreated or unmanaged, if someone's dealing with just a ton of stress day in and day out, they're just chronically stressed out, they're burnt out. Not good for neuroplasticity. If someone has experienced various forms of trauma, it could be full-blown post-traumatic stress disorder. Maybe some of you work with children and they've been exposed to high levels of child maltreatment, child neglect. Chronic pain, if someone is dealing with chronic pain issues, and chronic pain issues are very, very common after a head injury, but they're very common in many populations as well. Someone's dealing with headaches, migraine, joint pain, even IBS, irritable bowel syndrome, and chronic pain issues over the long haul can adversely impact neuroplasticity. And if someone uses drugs, alcohol, tobacco products, excessive sugar consumption, these are all threats to neuroplasticity. Other things we want to be aware of when we study this topic. Why do we want to care about neuroplasticity? Because when there are reductions in neuroplasticity, what does it impact? Memory, learning, and impaired flexibility. So flexibility, that is a component of executive function. Impaired flexibility basically means that individual may come off as a little more rigid, a little more stubborn. It's their way or the highway. If you know people like this, that is an impaired flexibility issue, which is basically cognitive or behavioral flexibility problems, which is a component of executive function. Executive function is the CEO of the brain. It guides the bus with day-to-day behavior. It's a critical component of goal planning and treatment planning. So executive function, huge topic to be aware of. Most people that have sustained a traumatic brain injury will be dealing with some level of executive function impairments. People that have poor time management, people that struggle with planning and staying organized, those are all red flag indicators of executive function impairments, amongst others, of course. So again, I said chronic pain before. I just wanted to show you a study, a really good article that again talks about maladaptive neuroplasticity within the context of chronic pain. Why do I point this out? I study pain. I've taken classes in pain nutrition. I've taken classes on behavioral health aspects, neuroscience aspects of pain. Why have I done that? Well, I've worked with many, many clients that have mental health challenges, and many of them are also dealing with chronic pain issues. So part of an integrative, holistic, multidisciplinary approach to the treatment of traumatic brain injury is also being aware if the person is dealing with any level of chronic pain, back pain, neck pain, joint pain, arthritis, the list goes on and on and on. If somebody is dealing with chronic and long-term social isolation, this is another area to target with intervention. Chronic isolation is just as bad as smoking cigarettes, the research says. People are shocked to hear that, but you'll find plenty of studies that show that chronic social isolation, I'm not talking about someone that is isolated for a day here and there. These are people that are alone, they don't have a lot of support. They're dealing with chronic loneliness day in and day out, week after week, month after month, year after year. That impacts their brain health. It impacts all kinds of other things as well. Some of you probably are aware I do a lot of work in the area of the gut-brain axis. Plenty of research also shows that if you want to strengthen neuroplasticity, you also have to strengthen the gut. Most clients, if you work in the field of mental health, behavioral health, and even brain injuries, the research is showing the individual is likely dealing with some level of gut dysfunction. Gut microbiota is part of the gut-brain axis. If you can enhance gut health, by default, that is enhancing brain health as well. I'll show you some different strategies to consider in a few minutes. Just in case we have mental health providers here, or take out the word mental health and put in behavioral health, put in medical, what coaches, case managers, anyone working in the helping professions, forensics as well, should become neuroplasticity informed. The research is very, very clear on this. This is a critical component to intervention. This is just a good, helpful reminder as well. There are just numerous studies that have been published on the topic of neuroplasticity within the context of different kinds of neurological and psychiatric disorders. And what the research has found is that if you are working with individuals with any kinds of these disorders or conditions, they're likely dealing with a reduction in neuroplasticity. So if we can strengthen neuroplasticity in these populations, by no means am I saying it's going to cure Alzheimer's disease, but it could make symptoms more manageable. It's supported in the TBI literature. It is supported if you are working with folks who have a schizophrenia diagnosis or bipolar disorder or schizoaffective disorder, and the list goes on and on and on. So, why again should we care about this? Why should we try to learn about intervention strategies as it pertains to strengthening neuroplasticity? Because it can help enhance memory, problem solving abilities. It can play a huge role in learning. So if any of you are working in a K through 12 environment, your school teachers or even college professors, learning about this topic can strengthen learning. There's research that also shows that if coaches, teachers, people that teach music classes can understand this topic, it can help enhance performance in hobbies and skills and interests and all kinds of things. So it's a really wonderful area of study that can be applicable to really almost any setting or situation. Again, we're moving quickly today because I want to save plenty of time for Dan. This next section is all about if someone goes to the doctor, if they have a mental health therapist, if we have any professionals in the crowd who are really wanting to become neuroplasticity informed, these might be some things to consider incorporating into the good work you're already doing. From a screening lens, these are things that can impact the rehabilitation process. This could be applied to physical rehabilitation. This could be applied to mental health treatment, substance use treatment, marriage and family therapy treatment, whatever it is. There's a million things that can get in the way of rehabilitation and goal planning. According to the research, this is the number one reason why people may not be successful with treatment. Anosognosia. Give lots of talks on this to different groups. People with brain injuries, not everybody with a brain injury is going to have this, but if you look at just what the research says, an elevated number of people who have sustained a brain injury may be dealing with some level of anosognosia. If you're asking yourself, what in the world does that term mean? That's okay. It's not talked a lot about in college programs. Anosognosia is the lack of awareness that I even have a brain injury, that I even have schizophrenia, that I even have a drug or alcohol problem, whatever it is. It's not denial. It's caused by the disorder or the deficit or the illness or the disease. It's something in the brain that is telling that person, I don't have anything wrong. I shouldn't listen to my doctors. I shouldn't stay on these medications. The doctors don't know what they're talking about. I'm going to go off my medications because I don't have schizophrenia. Anosognosia, big topic you want to be aware of. There's all kinds of other things on here as well. Couple things, just most of them are common sense. Alexithymia, another big topic that I give a lot of talks on. That's emotional blindness. This is going to be when somebody has difficulty naming, labeling, and making sense of emotions. This is also very, very common among people with brain injuries. It is very common among people with drug and alcohol problems. The research says between 50 and 65% of people with a brain injury and co-occurring substance use issues may be dealing with alexithymia. So this is a big, big topic to be aware of as well. And the other one I'll just mention because it's not talked a lot about is sluggish cognitive tempo. There's a lot of articles been published on this in the last several decades. There's some in the TBI literature, but basically what this is, it looks like inattentive ADHD. If you're ever working with someone that has true sluggish cognitive tempo, the client's going to come off as very spacey, apathetic, kind of deers in the headlights kind of look. Be curious when you see that. If you're working with a client, be curious. Don't jump to the conclusions that that individual is being lazy or doesn't want to be there. It could be sluggish cognitive tempo. Other factors to consider, just in case any of you are working in the area of mental health. And unfortunately, we know from the TBI literature, a very high percentage of folks with a brain injury are going to be dealing with some level of mental health challenges, impairments, anxiety, and depression being very, very common. This is where I do a lot of my work. A lot of you probably know I work in the field of mental health as well, outside of the work I do as a professor and a trainer and a consultant. Unfortunately, a high percentage of people with serious mental health challenges, and if you tackle or if you add on traumatic brain injury onto this, it gets even more challenging. Neuroplasticity can help combat a lot of these things on this slide, but from a screening and intervention lens, it's very, very important to be aware of what the person is eating. Are they smoking cigarettes? From that social lens, are they dealing with a high level of marginalization, stigma, racism, poverty, homelessness, and understand those health system factors as well? The more we can understand all of these moving parts, we can piece together this complex puzzle and develop a more individualized goal plan for that client to help that individual thrive and overcome maybe some of these challenges. This can apply to anybody. Unfortunately, if you live in the United States, these things are alive and well. This is part of the Western way of living. Eating unhealthy is very, very common. This is another reason why I'm taking a fifth master's degree right now in applied clinical nutrition. Understanding the role and impact that nutrition has on brain health is imperative. Prolonged sedentary behaviors is just as bad as smoking cigarettes as it is with chronic loneliness. Irregular times of eating, what does that relate to? I'm actually putting together an article for publication right now with a number of my colleagues on the field of chrononutrition. That's all about meal timing, meal skipping, late night eating, understanding our circadian rhythms. I did a training recently for Dan and his group on circadian rhythm misalignment and traumatic brain injury. I'd encourage you to take a look at that training, and I got into the weeds with that a lot more. Emotional eating, very, very common. All of these things, the more of these things a client is dealing with, the more adverse health outcomes that individual may also be dealing with. Other health compromising behaviors that we want to take into account, and a lot of these can impact neuroplasticity. Inadequate toothbrushing. How does that relate to this? Well, poor dental health adversely impacts heart health, gut health, and brain health. It's very, very important for individuals to meet with their dentist regularly. Skipping breakfast is a health compromising behavior. You'd be shocked to learn how many studies have been published on breakfast skipping and the poor health outcomes this can have, especially in kids when they're trying to navigate the school system. Not getting enough physical activity, sleep issues. We did a two-part series. The other training I mentioned was in circadian rhythm, but the first one in that series was a broad spectrum overview on sleep issues within the context of TBI. How many people do you know who are on their gadgets and social media and watching the screen late into the evening? That is a threat to human health. The more of these that we can eliminate or reduce, regardless of the individual, in theory, this should help enhance brain and body health, particularly after brain injury. The more of these things that are going on in that person's life who had a brain injury, recovery is often prolonged. It takes longer for that brain to heal. So the more we can be aware of these moving parts, the better off we're going to be.
There's a question about the keto diet and brain health. You have any thoughts on that?
Yeah, the keto diet, there's good research on that with some conditions. What I will say is that diet is more tricky. There's more restrictions. There's more adverse health outcomes that could result. It is imperative if you are working in the field and you want to look at dietary plans, nutritional habits, work with a registered dietitian and a licensed nutritionist. There's so many moving parts to take into account when we're talking about dietary interventions, especially the keto diet. When we think about the keto diet, think about if the person is already dealing with any kind of other kinds of medical health comorbidities. There's not enough research yet to say, hey, this is good for brain injuries. You'll find some studies out there, too complicated. What I would say, and I'm not giving any nutritional advice here, I'm just pointing out what some of the research says. And Dan, I think you and I talked about maybe doing a talk down the road on what does the research say about nutritional interventions for folks with a brain injury.
Yeah.
It gets complicated, but as a whole, what's the number one healthy dietary plan in the world according to research? The Mediterranean diet. Looking at that, it's usually more safe and it's less restrictive. But again, don't go out there and change your diet. Don't go tell clients to change their diet unless you have those proper credentials and certifications, licensures, all those things. As part of a multidisciplinary team, working collaboratively with a registered dietitian, licensed nutritionist is supported in the rehabilitation process for folks with a brain injury. Little bit about nutrition here. Maybe you're asking yourself, well, I have a client and the client just eats terribly all the time. Well, could it be they lack nutrition knowledge or they have executive function impairments and they can't plan and follow a recipe? That should alert you to the fact that this client might do well getting referred to a dietitian or nutritionist. The Western diet is a threat to brain health. Most people eat this way. I'm not saying if you go out and have fast food once in a great while, it's probably not going to cause a lot of issues. But if someone that eats this way day in and day out, year after year, it's been linked with all kinds of health challenges, including it can play a role in adversely impacting brain health. So the Western diet, this would be people that eat tons of red meat, processed foods, gas station food. If you look at the label of the food you're eating and the ingredient list is a mile long and you can't pronounce anything in there, that's probably part of the Western diet. If someone that drinks a lot of energy drinks, sugar sweetened beverages, they eat lots of candy, they don't hardly ever have vegetables, the Western diet impacts neuroplasticity. Why do you want to care about the Western diet if you have clients that eat this way day in and day out? Well, it's been linked with more obesity, chronic inflammation, allergies, diabetes, metabolic syndrome, neuropsychiatric issues. Another reason why it's imperative to work with qualified healthcare providers. Without a doubt, this way of eating every single day impacts neuroplasticity. If you're asking yourself too, what about excessive sugar consumption? Actually wrote a workbook. Think it's out now. I don't know. Send me a link. I can send you a link to it if you're interested. I wrote a workbook on excessive sugar consumption, and it's all just really practical for clinicians, things to consider. Excessive sugar intake is a threat to human health. Most Americans consume way more sugar than what the recommended guidelines say. If we're talking about this within the context of neuroplasticity, high levels of sugar intake impact brain health, impact body health, impact mood and behavior, to name a few. Just wanted to throw this in here because I find it interesting. Hopefully you do too. A lot of clients deal with depression. Lots of people deal with depression. If you're a human being listening to this, you've probably dealt with depression at some point. What are the foods, according to research, that are linked with higher levels of depression? Sugar sweetened beverages, people that eat a lot of sweetened desserts, processed pastries. So every morning you get up and go to work, you go to the gas station, you get your coffee and a pastry or muffin. That is linked with higher levels of depression, more gut health issues. Just being aware of this, another reason why we want to be aware of the topic of nutrition and seek out more knowledge about this. Collaborating with other professionals who have the proper credentials in this area. Why do we want to care about inflammation? Well, it is a very, very important target area for intervention for mental health challenges, for brain injury, rehabilitation. Chronic inflammation has been linked with eating not good, not getting good sleep, tobacco use, not moving a lot, obesity, and poor dental health, to name a few. Very important too when we talk about this is to understand social determinants of health. If your client is dealing with any one of these areas here, it's very important to identify and consider incorporating it into a goal plan or intervention plan. Some of these obviously are going to be a little more tricky to tackle than others. Climate change, for example, look at some of the air pollution literature in brain health, really fascinating literature and very disturbing as well. But what happens if your client is dealing with food insecurity? That is a very important area to target for intervention. Other things to consider. What happens if your client is dealing with poor mental health literacy, poor nutritional literacy, where they have a really hard time reading labels? They have a hard time understanding what medications they're on. Targeting this too with intervention could be very, very helpful. What are some things that can impact brain health and contribute to more cognitive decline? Well, genetics can play a factor here. Our health status, if someone never goes to the doctor and gets a physical checkup and they're dealing with a lot of physical health issues, that's a factor. What about neurochemical changes, hormones, neurotransmitter issues? What happens if they live a very unhealthy lifestyle and they just eat not good? These are all things that can impact brain health. According to research, these are the most common brain unhealthy foods. Who doesn't like this food? It's delicious, but it's hurting our brains. Without a doubt, there's tons of studies to support this. Again, just take a look at this. Most of us probably eat this way from time to time. But again, I'm not giving nutritional advice, but the more people can move away from this way of eating, the better off it is for their brain and body. Any questions, just type them in the chat box. So the gut, again, understanding the gut-brain axis, just Google the gut-brain axis and put in my name. I wrote an article on the national level that's very practical, short 5-minute read. It talks about this in much greater detail. But there's emerging research too in the traumatic brain injury literature that brain injuries and gut health issues frequently co-occur. It's embarrassing to probably talk about these things unless you're used to them and you talk about it frequently with clients, but being okay to start asking clients about bloating, gas, diarrhea, constipation. Why do you want to care about that? Because that's an indication that maybe their brain is not working at optimal levels as well. Red flag indicators that you're working with someone that has gut health issues, weight gain, weight loss unexpectedly, food sensitivities, unexplained fatigue, skin issues is related to gut health issues a lot of times. Autoimmune issues, very, very common, hormonal factors. Looking at this holistically, I'm doing a training coming up on the national level in 2 weeks on psychogastroenterology. It's basically taking gut health and combining it with the field of psychology and teaching mental health providers how to start screening and treating co-occurring mental health and gut health issues. But getting comfortable again with asking clients about these questions here. Again, you're not diagnosing a digestive health issue, but if you're identifying red flag indicators in somebody you're working with, referral to a specialist can be very, very helpful. This last section's all on tips, strategies, solutions, interventions. So from a lifestyle and behavioral kind of intervention lens, most of these are common sense, but the more we can look at how we live our life, are we living in moderation? Are we exercising? Are we around positive people? What do we eat? Are we resting periodically? Are we just go, 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 go and burning ourselves out and we're dealing with burnout and we're just feeling anxious and irritable? All of those things are not good for neuroplasticity. What are the major elements of living a healthy lifestyle according to research? Easier said than done here. And you'll find many studies saying different things. A whole food, plant-based diet is talked about. That's easier said than done. Again, working with a qualified healthcare professional, because if someone decides to go this route and they only eat plant-based foods, you got to be aware that you might not be getting enough protein in some cases. There might be some mineral deficiencies. So it's very important to work with healthcare providers who understand the moving parts of this. Making sure you're getting adequate amounts of physical activity. Sleep, in my opinion, is the foundation to health. And then taking care of our emotional health as well. How do we support brain health? Lots of things to consider. Very common sense things. Taking care of our mental health supports brain health. Taking care of our dental health, our gut health, being very mindful of what we eat, enhancing our relationships with other people. If people are dealing with a lot of interpersonal conflict, conflict with coworkers, neighbors, support relationship building. That can be very good for brain health. What are some good habits, according to the research, that can help support optimal brain health? Again, a lot of these are overlapping, but different studies say it in different ways. Eating healthy, exercising, not just getting good sleep, but making sure you have plenty of rest as well. Having a mindset of optimism, gratitude, hopeful thinking can be very, very helpful. Managing stress. Having variety can be helpful and challenging yourself. If you're somebody that avoids any kind of strenuous mental activity, you're not exercising your brain. Being around people who are healthy, being in good friendship networks, learning a new hobby and doing it repetitiously over and over again. These are things that are great for our brains. What does the research say specifically about a healthy lifestyle and neuroplasticity? It's all common sense. It says exercise. It says eat healthy. It says get good sleep. And doing reading. Maybe it's playing chess. Maybe it's doing something called neurobics and you're exercising your brain. Other things that can promote neuroplasticity, meditation, maybe working with a therapist who understands this through a cognitive behavioral therapy lens, having a gratitude journal, maybe doing neurofeedback with a qualified specialist. If we look at this through a cognitive training lens, there's a multitude of things we can do to support neuroplasticity, enhance our problem solving skills, learn new things. It's not going back to get a new degree at college, but maybe taking a community ed class, picking up a book and reading something, watching a YouTube video, just learning new things can be very, very helpful. And engaging in mentally stimulating tasks. If someone is just inside all the time, laying around, watching TV, that's not engaging in mentally stimulating tasks. Get outside, experience nature, join a group, do something like that. That can be very helpful. I love therapeutic lifestyle changes. It's very common sense if we have mental health providers in the crowd. This comes out of the neuro counseling literature. But these are the 5 most important components to therapeutic lifestyle changes according to this research. It complements everything we're saying today. Working with clients on eating healthier, helping clients move more, maintaining adequate weight, reducing screen time exposure, particularly in the evening, and doing anything we can to help people enhance their sleep health. Lifestyle medicine, I have a certification in lifestyle medicine. I love lifestyle medicine literature. It complements all the things we're talking about today. It is all common sense, but the 6 core components of lifestyle medicine is physical activity, stress management, eating healthy foods, getting restorative sleep, avoiding harmful chemicals that include a lot of sugar, a lot of caffeine, and a lot of tobacco, and enhancing positive social support and connection. There's a couple articles that have talked about lifestyle medicine within the context of blue zones. Maybe some of you have seen some of these documentaries on blue zones or read books on it or looked at some of the websites. Just in case you haven't, basically blue zones are regions in the world where they have the highest concentration of people who live over the age of 100. And researchers have gone in there and asked people like questions, they've studied those cultures, and in a nutshell, The common factors between these different blue zones around the world is they move more naturally. They're not like going to the gym and running every day on a treadmill for 30 minutes, 45 minutes. They're just out there moving constantly, gardening and using their body. They eat very wisely, so healthy foods, they don't overeat. They do everything they can to minimize stress. They put a premium on getting good sleep, having a sense of purpose, and these other things here. You can look at them on your own time. But blue zone literature I really like. I find it fascinating. And there's many, many blue zones around the world. And I think we can learn a lot from these different blue zones. And there's only one blue zone in the United States in California. All the other blue zones are in different regions of the world. How do we promote positive well-being, emotionally, behaviorally, cognitively, enhance self-esteem, promote optimism, laugh more, have a greater satisfaction with life, promote self-efficacy? How do we promote an active lifestyle? Well, picking up a hobby. Maybe someone has mobility issues and they can't really go out and do a lot of walking. Maybe chair yoga, heated pool therapy, working with an exercise specialist who understands brain injuries or mobility issues. Exercise is medicine without a doubt. Plenty of research shows that physical activity can enhance neuroplasticity. At the biochemical molecular level, what's going on? Why does exercise enhance neuroplasticity? It boosts brain-derived neurotropic factor. That'd be a topic you absolutely want to be aware of. It reduces inflammation. It plays a role in reducing oxidative stress, and the list goes on. Really fascinating stuff. Relaxation and meditation strategies, mind-body interventions. Maybe it's yoga, it's deep breathing, maybe it's neurofeedback. These are different approaches that people may be able to work with providers that can strengthen brain health. I love health coaching. Maybe we don't have therapists here, but there's coaches, there's case managers, there's advocates. Learning about health coaching literature can be very helpful in helping people enhance overall health and well-being. Here's a little bit about health coaching. It's patient-centered. You're helping clients determine their goals collectively. You're not coming in there and telling the client here's their goal. You're working collaboratively. You're using encouragement, motivational interviewing. It's really strengths-based approaches. If you can use health coaching interventions effectively with people, it helps enhance self-reflection. It promotes more motivation. It focuses on the strengths rather than focusing on the negatives. And it can really help people overcome past challenges they may have had with other providers, and they're more likely to succeed. And health coaching interventions can be used with any population. I mentioned neurobics a few minutes ago. Neuro, we've all heard about like aerobic exercise. Basically, neurobics is aerobics for our brain. Just Google neurobics, you can find all kinds of cool stuff online. The more we can do different things to strengthen our brain, in theory, we're promoting more neuroplasticity. Other things that may promote neuroplasticity, and I think we've covered pretty much all of these now, but to recap, mindfulness meditation, cognitive training, exercise, eating healthy, cognitive behavioral therapy can help with this as well. The more we can help people, and just, I'm not giving medical advice today, but the more we can move from the right side column to the left side column, the better off we'll be. See the ketogenic diet in here. Again, I'm not advocating for anyone to go start that. There's some interesting research on this, but it is a more restrictive dietary plan. So it's so important to do that in conjunction with a healthcare provider. It's not appropriate for all people. The things on the left, in theory, help bring down inflammation and promote more healing. The things on the right drive up inflammation and get in the way of recovery with whatever it is, including brain injuries. That's all I got for you, folks. Here's my email address. Shoot me an email if you have questions, thoughts, concerns. Dan, do you want me to take any questions for a minute or
Um,
two, or?
Great, Jared, thank you. And there is maybe we could do a few questions. There's one in the chat about how to manage basically dysautonomia as a result of brain injury, which results in heart rate getting too high and leading to symptoms when the person is trying to exercise. So how do you manage that? Also raises the blood pressure and can lead to seizures in this person's case.
That is another reason why when you're developing these individualized plans, you have to work with professionals who understand this literature. And the question will then be, well, where do we find those professionals? They're out there, but they're few and far between. I don't know too many exercise specialists that truly are an expert in traumatic brain injury. They're probably out there, but I think a starting point would be is collaborating with brain injury specialists and exercise specialists who want to hear from the brain injury experts, and you work collaboratively. But we also have to be aware too, maybe the person's dealing with some metabolic issues and they're dealing with blood sugar dysregulation or full-blown type 2 diabetes. It is so imperative. Get a physical, work with the healthcare providers. And basically, once we figure all that out, you got all the data there, we know what we're dealing with, and we got the team together. We got the exercise specialist, maybe we have a nutritionist on board, we got the healthcare provider. Everyone's talking collaboratively with the client. Then, if you develop an exercise plan, you start very slow. You monitor the person, you monitor those blood sugar levels, you monitor possible hypoglycemia, you monitor some of these other symptoms, and you consistently go back to the drawing table and you make modifications to it. But you're not going to start out day one going out there and running as fast as you can. You might go start out and go for a very light walk. Stop, just go very slow. You'll find some interesting research in the walking literature that just a 6-minute walk after a meal can be very beneficial. The only kicker to that is a lot of those studies weren't done with folks with brain injuries, so it does get tricky. Dan is the brain injury expert here. What would you say about that with the exercise from a brain injury lens that I didn't share?
I think that your points are accurate, and it so first of all, it's hard to find that team of experts that can help or someone that can help. But if you can't find that, then that's great. That's super critical and valuable. And I do meet people that find the right help. It just takes a lot of work to get to it. So they're out there. It's just hard to find sometimes. And then the other thing about so someone else who also has a dysautonomia with brain injury. Pacing is critical, and I think that that's absolutely that's the approach that I'm gonna at least somewhat speak about. And recently, I had seen long story, but Sylvie, a woman named Sylvie, has a concussion community, and she talks about her progression of exercise from almost doing nothing to if your goal is a 6-minute walk, you sometimes have to start with a 20-second walk at first. And she describes this progression, and she describes the doctor at Cognitive FX in Utah who sort of advocated and showed her how to do it, and she didn't believe it. But anyway, she's describing the baby step approach that I learned by default in rebuilding my cognition and other problems. So I think that if your heart rate gets to 100 with 5 minutes of exercise, what if you do 2 minutes of exercise? And sometimes that takes months to then get to a little bit better. I don't know. That's the only advice that I can recommend. Also, yeah, finding the right help, finding the right support, all this stuff. I'm gonna get into it too a little bit. What Jerrod said with the diet, the exercise, the sleeping. Together, these factors contribute to the nervous system being a little better off, but it's still a progression.
And one more thing I'll say, like if someone, I have a graduate certificate in exercise prescription and wonderful program, but we didn't really get into PBI in there too much. But I do think, Dan, we should maybe consider a talk in the future on physical activity within the context of brain injuries. Here's what the research actually says. But if you're really interested in developing an exercise plan and you have a TBI, it might be good to do the exercise intervention with a professional, not just doing it on your own, so they can monitor you and do it in a center or a clinic where they can monitor your vital signs and things like that at first and really have that medical attention right there. And I know when I say collaboratively working as a multidisciplinary team, I'm realistic. I know there's a lot of professionals out there that don't like collaborating with other folks. don't want to hear advice from other disciplines, and that gets frustrating. What do you do in that? Well, keep shopping around and find providers who are open to that, is my biggest piece of advice.
Yeah, the collaboration and the finding the right help, they're both uh, part of the reason for these talks is to try to educate basically anyone that'll listen that's a professional, because I think that they are realizing their brain injury has certain needs that they don't know about. So thank you, Jerrod. That was really good. I appreciate the
You're welcome, Dan.
presentation.
Thank you. Thank you, everyone, as well. Reach out if you have questions, folks.
Yeah. So you can email Jerry, you can email me. Okay, so we're gonna shift now. I'm gonna do my talk, and if you have any questions, put them in the chat.